Hello and namaste everyone. Today we'll be talking about the ulna. Ulna is the medial bone of the forearm and is slightly longer than the radius. The term ulna is derived from a Latin word meaning elbow. The ulna acts as a stabilizing bone over which the radius moves, producing the pronation and supination movements of the forearm. If compared to the lower limb, the ulna is homologous to the fibula of the leg. Presenting features. Just like any other long bone, the ulna has two ends, the upper end, the lower end, and an intervening shaft. Articulations. Superiorly, the trochlear notch articulates with the trochlea of the humerus, forming the humero-ulnar component of the elbow joint complex. With radius, it forms the proximal radio-ulnar joint, middle radio-ulnar joint, and the distal radio-ulnar joint. The proximal and the distal radio-ulnar joints are of pivot type of synovial joint, while the middle radio-ulnar joint is the syndesmosis variety of fibrous joint. It should be noted that the ulna does not contribute to the formation of the wrist joint. Side determination. For side determination, following points should be considered. The trochlear notch is present superiorly and its concavity faces anteriorly. The sharpest border, the intraosseous border, is present laterally. Therefore, this is the right ulna, while this is the left ulna. Anatomical position. It is held in a vertical fashion. Describing the features in detail, we begin with the ends, upper end. It has two processes, the olecranon process and the coronoid process, and two notches, the trochlear notch and the radial notch. Olecranon process. The term olecranon is derived from Greek term olini, meaning elbow, and kranon, meaning head, implying that the olecranon is the most bony prominence in the elbow region. It is the prominent proximal hook-shaped process of the upper ulnar end. Its anterior surface is articular, and during extension of the elbow joint, the olecranon process enters the olecranon fossa of the distal humerus. Its posterior surface is subcutaneous and forms the tip of the elbow. The olecranon bursa covers the posterior subcutaneous surface, and it is important to remember that olecranon bursitis, also known as student's elbow or baker's elbow, is one of the most frequent types of bursitis. Triceps brachii muscle is inserted on the superior surface of this process, and it would not be wrong to state that violent contraction of the triceps may fracture the olecranon process. The three bony landmarks of elbow region, that is the olecranon process of ulna, the medial and the lateral epicondyles of humerus, come to lie on the same horizontal plane during extension of the elbow joint. Also, during flexion of the elbow joint, these three landmarks form an isosceles triangle. It is important to note that this triangular arrangement is preserved during supracondylar fracture of humerus, while the triangular arrangement is disrupted in the dislocation of the elbow joint, helping to distinguish these two common medical conditions. Coronoid process. It is a triangular prominence projecting anteriorly at the upper aspect of the ulnar end. Its upper surface is articular, and during flexion of the elbow joint, the coronoid process enters the coronoid fossa of the distal humerus, thus preventing the hyperflexion. Its anterior rough surface continues inferiorly as the ulnar tuberosity. Brachialis is inserted onto the anterior surface and the ulnar tuberosity. Lateral surface bears articular concavity, the radial notch. The supinator fossa is present inferior to the radial notch. Sharp posterior margin of the supinator fossa is called supinator crest, which gives origin to supinator muscle. Supinator crest continues inferiorly as the interosseous border of the ulna. Trochlear notch. Trochlear notch, also called semilunar notch or greater sigmoid cavity, is a C-shaped notch with its concavity facing anteriorly. It is formed by the articular surfaces of the olecranon and the coronoid processes. It articulates with the trochlea of the distal humerus, forming the humero-ulnar part of the compound elbow joint. Radial notch. The radial notch, also called lesser sigmoid cavity, is present on the lateral surface of the coronoid process and articulates with the circumferential articular surface of the head of the radius. Annular ligament, which holds the head of the radius, is attached to anterior and the posterior margin of the radial notch. In children aged 2 to 6 years, the radial head may slip out of the annular ligament, causing pulled elbow. Lower end. The tapering lower end of ulna presents a head and a palpable styloid process. The head articulates with the ulnar notch of the distal radius, forming the distal radio-ulnar joint. Presence of an articular disc inferior to the ulnar head leads to the exclusion of ulna from the wrist joint formation. The groove between the head of the ulna and the styloid process is occupied by the tendon of extensor carpi ulnaris. Shaft. It has three borders: the anterior border, the intraosseous or the lateral border, and the posterior border, and these surfaces: the anterior surface, the medial surface, and the posterior surface. The intraosseous border is sharp lateral border which is attached to the intraosseous membrane. The posterior border is rounded and subcutaneous. Superiorly directed nutrient foramen is present on the anterior surface. Since the nutrient foramen is directed towards the elbow, we can conclude that the lower end is the growing end of the ulna. Ossification. Ulna is formed by endochondral ossification from one primary and three secondary ossification centers. Primary ossification center is apparent in the shaft or diaphysis during 8th week of intrauterine life. A secondary ossification center appears in the distal end at around 5 years and expands to styloid process. At the proximal end, two secondary centers appear during 10th year. Proximal end unites with the shaft at 14 to 16 years, while the distal end, which is also the growing end, fuses with the shaft at 17 to 18 years. Clinical applied anatomy. Nightstick fracture. The posterior border of the ulnar shaft is subcutaneous throughout, and the fracture of ulna alone tends to occur during defense against trauma, known as the nightstick fracture. Monteggia fracture. It is the fracture of the proximal one-third of the ulna associated with dislocation of the proximal radio-ulnar joint. Galeazzi fracture. It is the fracture of the distal one-third of the radius associated with the dislocation of the distal radio-ulnar joint. So that was a brief osteological description of ulnar bone. Thank you for watching.